there, this is John, and this is the IGEL intubation skill. First, I'm making sure the scene is safe. I've got my safety gear on, my glasses, and my gloves. Next, as I'm approaching the patient, I'm going to have my partner insert an oral pharyngeal airway and have them ventilate the patient 1 every 6 seconds with 100% pure oxygen. So your partner will do that for you, and they will ventilate the patient, ensuring there's proper rise and fall of the chest. So for the sake of the argument, we'll say that's happening right now with my partner. In the meantime, I'm going to check out my equipment. I have a stethoscope. There's a colorimetric device I'm going to use to check the carbon dioxide levels, KY, and in the packaging, you're going to get the IGEL and the strap to retain it. Now, this is a size 3 IGEL. This fits from 36 to 60 kilogram patients, and this patient does fit that device. Next, what I want to do is I want to take the retaining strap and place it under the back of the patient's neck, aligning it roughly with the level of the mouth, because I will be using that to secure the device in place, provide that proper tension to hold the seal nice and tight over the glottic opening. I take my device out of the cradle, comes in a little plastic cradle, and I'm going to hold this aside so that I don't put it on the ground or get it, contaminated. I'm going to apply some KY to the plastic cradle, and then I'm going to lubricate the IGEL device, the sides, the back, the spine, and the tip as well, to making sure that it's properly lubricated. With this, you can put it back in the cradle and have it stay there to keep it sterile until you're ready to use it. You can also, at this point, take your colorimetric device and apply it to the device ready to use once you do intubate. So I'm ready to do this. I'm going to have my partner stop ventilating. They're going to take out the OPA for me, or for you, I guess. I'm going to stand at the head of the patient. I want the head to be in a flexed sniffing position, so the nose should be facing straight up in the air. Either yourself or your partner can do this. They can take their thumb and forefinger, and they can push down on the chin to open the mouth. I'm going to apply the IGEL by holding it firmly at the top here by the bite stick part. And I want to direct this downward and backward towards the roof of the mouth. So straight back, you can see nice firm pressure all the way down until you feel resistance. And at this point, there's a black line that's printed on the barrel of the device. The black line should roughly be about the level of the person's teeth. At this point, what I want to do to keep that tension on that, I'm going to apply the strap to this, and I want to make sure that there's some good tension to hold this device in place. Next, at this point, I can have my partner start ventilating for me 1 every 6 seconds, so that they'll do that for me 1 every 6 seconds. And what I'm going to do while they're ventilating, I'm going to check SD lead. So first I want to check abdominal sounds. Give me 1 breath. There's no abdominal sounds. I see rise and fall of the chest, and I hear equal lung sounds bilaterally. Also, I notice that the colorimetric device has gone from purple to yellow, and now it's yellow in 5.0. So I know that I'm in the right place, and I can finally secure this. So my partner's still ventilating. I'm going to apply the cervical collar because we will be moving this patient from where we found them. And on the way to the hospital, I'll be calling the base hospital to tell them what's going on. I'll give them SD lead. So the size was a size 3 IGEL. The depth was to the black line. The lung sounds were clear bilaterally with good rise and fall of the chest. Abdominal sounds were negative. The end tidal was yellow in 5.0. And of course, I will document all of this at least twice on my patient care report once I get to the hospital. And we're done.